In this episode, we explore some of the challenges that faced George Washington and his presidency during the time of the 1793 yellow fever epidemic. This is an interesting case study that examines that Washington's presidency was not a walk in the park, but one that was built on tests and trials, successes and failures all together that helped define the nation's capability to withstand even some of the worst public health crises that faced America. Let's begin. Patriotism, faith, national unity, education, fiscal responsibility, civility, the values that define America. Fascinating stories and talks from America-loving patriots dedicated to preserving freedom, opportunity, and justice. Welcome to the Friends and Fellow Citizens podcast. Ladies and gentlemen, welcome to another episode of Friends and Fellow Citizens. I'm your host, Sherman Tylowski, in our third to final episode of 2020. Today we are exploring a case study that highlights some of the early public health challenges that faced America. I think this is appropriate given the current time that we are in as of this recording here in December 2020. But before we get started, I would like to add a couple reminders to all of you. Number one, make sure that at the end of this episode that you subscribe and share this podcast with your friends and family. I really appreciate your support. You all have been phenomenal in becoming my audience, and I just want to thank you so much from the bottom of my heart for every week of support that you give me. But the second announcement has to do with a new custom that I have decided to implement here in this podcast. As you know, with 24/7, there's just so much coverage, so much news, so much politics, and all the stuff that's happening nowadays. And I just think it's too much. I have said repeatedly that politics should stay out of things that really unite us, things like sports, things like entertainment, even holidays. These kinds of activities are supposed to give us different flavors in life. And the fact that they're being politicized far too often in this day and age, I think is a real disgrace. It's a disgrace to not only politics, but to the entities that are being politicized right now. And on Friends and Fellow Citizens, we're going to make a stand. And so I've decided that this will be our final 2020 episode dealing with, as you could say, probably more substantive issues. Last week, we discussed North Korea. A few weeks ago, we discussed civility in politics. We've discussed the Space Force. We've discussed foreign policy of the Middle East, all kinds of subjects. And we have plenty of time every year to discuss them in detail. But there are times when I think we should be coming together and celebrating the special events that surround us. And so for the final 2 weeks of 2020, an interview show, next week's interview show, and my solo show the week after, both of those episodes are only going to be dedicated to celebrating the holidays. And I've got an experimental but special episode next week for all of you. This will be our first episode featuring more than 2 guests. The maximum I've had one of my episode shows has been 2 guests. There's going to be way more. And I can't wait to share that with all of you. I think it's going to be a really great one and a really excellent break from so much that is happening on 24/7. I don't know about you. I just can't begin to imagine how people can even be immersed with politics 24/7, 365. I mean, people need to keep their brain cells, for crying out loud. But anyway, I've made that decision, and I think it's going to be a really good break for all of us, and it'll be a good way to segue into the new year, 2021. So look out for those 2 episodes coming up in the rest of December, and for the winter holiday season. The winter holiday special in the next episode, the next interview episode, and my holiday special solo show coming up the week after that. Now, on to this episode. I've chosen a very unique time period the early 1790s, which is unique because Washington's presidency is often glossed over. As we perceive, and understandably so, we perceive Washington as a leader who obviously had his struggles, but who gradually refined that leadership style. And I think to some degree that's true. But there are the inner workings and the inner events that really define not Washington as the end leader of all the major issues that plague the United States. Far from it. In fact, for him, it was also a learning experience and a learning episode. The 1793 yellow fever epidemic is really one of those events that is often glossed over. But just to recap, yellow fever is a viral infection that usually causes fever and jaundice. And at that time, it was very, very severe. There was no cure for that. This was a new disease, certainly very much like the COVID-19 virus, very much unknown, and particularly plagued Philadelphia. Now, Philadelphia is right next to the Schuylkill River, but it's also surrounded by another body of water here, which is the Delaware River. And Philadelphia was a major port with all these ships coming in and out of its harbor. And then all of a sudden, they started having cases in 1793. This was earlier in the year, and people just started getting sick. At that time, Philadelphia was the largest city in the United States in the United States at that time, certainly a very new United States. And at that time, 50,000 people, which is considered the largest city at the time. It was also the capital of the United States at the time. Washington, D.C. was not conceived until several years later. And so President George Washington was residing in Philadelphia at the president's house. The Congress also convened in Philadelphia, and all of a sudden this outbreak comes along. And now we've got big problems. There was contamination from sewage. There were people not cleaning up the streets from garbage. There were people who were just not being sanitary in their habits. And it was really a cesspool. There were a lot of infrastructure problems, but a lot of societal and cultural problems that were associated with this issue of sanitation in Philadelphia. And people started scrambling. They started to figure out, okay, what do we need to do now? And as the cases grew, so did the deaths mount. We've had early hospitals, including the Pennsylvania Hospital, which was the first hospital established in the United States in 1751. But that wasn't very well equipped for this kind of outbreak. This was a whole new challenge on top of the other challenges that we all know about, including the debate on slavery, the debate on federalism, the role of the federal government, which still continues today, the role of foreign powers. These are all still simultaneously happening as this epidemic started growing in Philadelphia. And as it grew, other cities really wanted to stop refugees from fleeing Philadelphia into the other cities like New York, like Baltimore. And those cities started putting down restrictions. Restrictions include roadblocks, including quarantines, including patrols, all kinds of kind of border checks, so to speak, almost like mini border checks within the U.S. And with a population of 50,000, 20,000 people fled Philadelphia. That's 40% of the population. If you think in terms of proportions for, let's say, take New York as an example, right? If New York has, say, 8.5 million people, and we're talking somewhere along the lines of 3.4 million people fleeing New York today. That's unheard of. It was a mass exodus. And unfortunately, many of these people were wealthier. They could afford to leave the city. But many of the poorest had to stick around. It is very challenging, as you can imagine. I mentioned that the hospitals were not equipped. You had everything from broken beds to inexperienced physicians, some of whom many of whom hadn't even graduated from med school, and they were tasked to try to treat patients, but they didn't have the equipment. These were really, really challenging times. In fact, it got so bad that President Washington actually had to leave Philadelphia. And he finally convened his cabinet in a place called Germantown, which is at that time was an independent town. It's now part of the city of Philadelphia. It was about 10 miles out from where the center of the city was. But the president of the United States had to flee, and there were major concerns that Congress couldn't convene. And so these early outbreaks and these challenges to the healthcare system, the challenges to the ability for the leadership to even carry out its duties, and these challenges kept mounting. Philadelphia even put together a mayor's commission, to task and determine how they were going to deal with this outbreak. Some people were waiting for winter season to come along because they thought that was going to be able to kill off the yellow fever epidemic. Others were saying that we need to cut off people from certain parts of the world that they thought had yellow fever, or the people who thought were the ones who carried this disease. Some people assumed that there were some French merchant ships that came to Philly to unload goods and all the rest, and there were some people who were on the ship that had carried it. I mean, there were just so many reasons and so many possible explanations for how the outbreak began, but none of these were actual solutions as to how to keep this epidemic under control. The Mayor's Commission convened everyone from politicians, even down to people who made wooden barrels. Unfortunately, even the epidemic ravaged the commission. There were some members of the commission who unfortunately fell ill and passed away because of this terrible outbreak. Finally, one of the most notable founders in this whole episode is Dr. Benjamin Rush, who is a founding father and a physician. And Dr. Rush had a reputation for being a very adept scientist, and he had his reasons, he had his theories, he also had his evidence that he tried to present to other scientists and the lawmakers and decision makers then to try to explain how people could stop this terrible disease. One potential remedy that was circulated amongst certain scientists and certain physicians was that if people drank wine, they'd be able to cure that. Now, unfortunately, that didn't work out very well. And unfortunately, it resulted in people having more skepticism of the scientific community. People, as they were reading more about what Dr. Rush was saying about some of the other reasons and some of the other remedies that he put forward, some of them unfortunately including maybe not so sanitary kind of methods. I talk about scientific evidence that didn't even add up to the science that it was hoping to match up to. Nowadays, I think we call it disinformation. We call it certainly unscientific methods of solving anything. But this was at the time, even before the age of the internet, even before the times of Facebook and of Twitter, where people could scroll through and read about any news that they want. I don't think this is a comparison. I'm certainly not here to compare the 1793 epidemic to the COVID-19 pandemic, but I think there are similar lessons here and similar lessons of philosophies that we're encountering here in the United States that I think warrants further exploration and further reflection. There's this mantra that's been going on, and something that really disturbs me. And this is something that's coming from me as non-scientist. I will admit to you that I am not a science person. I love my science classes. I absolutely support scientific innovation, and I think there are a lot of schools that have a lot of opportunities to be able to expand on scientific endeavors. But I am one to say that one of the greatest injustices that I've been hearing is the fact that there's people saying, well, you got to follow the science. And I just look at them, it's like, what do you mean follow the science? Why is it that you have the science when people back in those days didn't even understand what the disease was? You had top people like Dr. Benjamin Rush, who had a huge reputation. I mean, he was, again, one of the founders, one of the signers of the Declaration of Independence, and even he couldn't figure it out. So I'm just saying that there is a bit of dishonesty that's been circulating around our society nowadays, where we think that the science we're debating now is about the question of whether or not the Earth is flat. I think it's 1,000% safe to say that the Earth is round. I don't think there's, in terms of percentage, virtually nobody believes that the Earth is flat. But that's not a valid comparison to the continuing scientific study of the coronavirus vaccine. And it certainly is not even a good comparison to the 1793 outbreak that I've been highlighting for the past several minutes. If people then follow the science, I can tell you that there'd be a lot of people doing things without knowing what they're doing and probably hurting themselves far more in the process. I don't want to go too much into detail on specifically what these other kind of scientific recommendations are. All I can say is that to non-scientists and scientists alike, we could look at those and be like, you know what? I think there's something really, really wrong with the information campaigns that were going on at the time. It was bad. And so I put that out because when I keep hearing people saying, you have to follow the science, I think there's just a number of things very much wrong with that. And throughout our episodes in the future, as we discuss not just the pandemic, but just about scientific, or when I say scientific, I mean fit the physical sciences. When we discuss these topics, we have to be very frank about our areas of expertise. I don't expect everybody to be an expert on physical sciences. There are people who have gone to school, have spent countless hours, have spent countless amounts of energy studying these concepts, pushing the field forward. Why not recognize those people for their contributions? Maybe we can agree and disagree with them. And many of the people who say that we have to follow the science are the same people who don't have a clue as to what so-called the science is. There are plenty of qualified scientists who disagree on whether or not a country should go into lockdown mode. There are scientists, very qualified scientists, who disagree on whether or not the FDA, the Food and Drug Administration, should approve the Pfizer vaccine or the Moderna vaccine. They have their own reasons. And just like most, if not virtually all, non-scientists, I have no way of determining whether or not a set of scientific data results in a definite conclusion. I don't even think even scientists could even say that. So this brings me up to really the 3 points and 3 big takeaways that I think are going to guide us into our discussions and conversations about not just about COVID-19, but about future public health issues and other topics of interest, including scientific developments and endeavors. And we'll start with number 1. The first is that public health, I think, really should be a national, state, and local issue. It might sound obvious at first, but I'll speak from personal experience first, and I'm sure many of you out there have your own personal opinions and experiences. As I roam around some of the cities in the U.S. before the pandemic, I mean, there were signs, and this is part of living in the big city, I understand, but there was this sort of numbness about sanitation, about people not being responsible for taking care of their health, of their hygiene. And there were just everything from trash to poor management of the sanitation department on the higher levels. There was so much disregard for public health because it seemed perhaps too much of an individual matter, in the sense that because I'm an individual and I have my own way of living life, So if I don't take care of my health or my hygiene, well, it doesn't really affect anybody else. Maybe that has been a recurring, a recurring problem and recurring individual idea before the pandemic. Now it might be very different. Now people are certainly a lot more aware. Unfortunately, I also do think that a big harm to public health is fear. We have seen so many cases where people are so frightened, and unnecessarily so. We need vigilance. We don't need fear. We need vigilance. We have to confront these public health issues at the national, at the state level, and at the local level. But unfortunately, I've met people who are just so paranoid, and I can't do anything but pray for them, because that's not the way anyone should live their lives. No one should live in constant fear. No one should live in paranoia. I think people should live in vigilance. Vigilance is about living the life that you want to live, but doing so with a kind of caution that keeps yourself safe and keeps others safe. It's about opening one's eyes and noticing one's surroundings. I think that's a good combination. But going back to the public health focus that I've just mentioned, it could be a defining characteristic of policies nowadays and in the future. I don't see how the people will look at the same kind of sanitation problems the same way anymore. Whether it's grime on a piece of railing, or whether it's litter on the street, or whether it's perhaps the cleaning practices of certain entities, a lot of things I think will have to change. But I hope that the direction that we're going in is one of vigilance. That public health is now a vigilance philosophy. It is not a philosophy. It should not be a philosophy of fear. It should not be a philosophy of excess expenditures that go nowhere, or of massive restrictions and massive regulations without any kind of scientific evidence, without any kind of even attempt to defend those actions, without saying something along the lines of, well, we are in a pandemic. We all know that. Where is the scientific evidence? Show us the evidence. Show us which scientists a leader has consulted. I do think there's also another area to this. This is at least in my second point. And the second thing is, there are huge entire teams of people working to contain and stop the pandemic in all levels. It's very difficult perhaps to understand, even from my perspective, just how big of an operation this has all been. Everything from personal protective equipment to vaccine development. If I were to go back to that 1793 example, remember this: the epidemic in Philadelphia was not the only one. There were epidemics across the country. There were ones in New York and Baltimore, even down south, perhaps in the Charleston area and amongst other cities, and even all the way up to Boston. And these challenges really started to add up, and there are people working in all different capacities. Everything from quarantine measures, ensuring that people were quarantining to try to limit the spread. There are people tasked to build up that hospital. I mentioned that the broken healthcare system that was going on in Philadelphia. And while it was not as successful of an operation as it could have been, especially given the limited resources at the time, the hospital capacity and the resources improved so much more in Philadelphia. People started repairing the beds. People started providing the medical equipment needed to treat patients. Hospital capacity could only house perhaps, or could treat only about a couple dozen people, maybe more. But one hospital was able to serve around 160 or 170 people. And it was just a massive operation. And it just simply didn't take one person or a handful of people. It took a whole team of people, including at that time a number of African-American nurses who pitched in to try and help the city recover. And on top of that, there were cities like New York trying to provide aid, even in monetary aid, for Philadelphia. There are people in the federal level determining how to coordinate different states so that they could work together to find the causes, to find the roots. Ultimately, that was not successful. It didn't take anybody until, I believe, in the early 1900s that someone was finally able to determine that yellow fever came from mosquitoes. It took over 100 years for that to be determined. But then all these other states and all these localities tried everything they could to work this out and figure out ways to mitigate this epidemic, which unfortunately went through a number of years. But this was just one of the many instances that I often emphasize about our federalist system. That it's not just about one county. It's not just about one area. When we have a whole country, we have to pull together as much as we can. But at the same time, we also have to leave that many of these discretionary powers, many of these individual powers, to our localities, to our states, to our cities and our counties. And to go back to my point about this whole team of people, I use a very innocent example nowadays. I really hope that more people will look into Operation Warp Speed. That is the current program and a government, essentially a private-public partnership started by President Trump and the Trump administration that facilitated the development and now the distribution of COVID-19 vaccines. And I don't think there's really any understanding nowadays. I think this is going to take some time for us to really see as how the distribution goes along and see, and with the benefit of hindsight, how things have gone through from the beginning of the pandemic to the end. I think there's a whole team of people, everyone from the lawmakers in Congress to the White House officials, all the way down to the private sector employees, all the way down to the FedEx and the UPS trucks that are driving on our streets right now delivering those vaccines. There is a whole team of people working around the clock trying to resolve one of the biggest pandemics this world has ever seen. The scale of it, certainly in modern times, has been unprecedented. And there's a whole team of people working to try to get this under control and to resolve this once and for all. And I think that warrants a huge amount of gratitude to many scientists and to the many people who have contributed to this effort. People on both sides of the aisle who have done a lot to resolve these problems. Not saying that everyone was perfect. There were people who were wrong in many different levels. But the fact that the FDA was able to approve the first COVID vaccine on December 11th, 2020, so many of the bureaucratic challenges that have plagued the FDA and many other government agencies were wiped out, leaving predominantly the development, the scientific development, and the logistical efforts to get this vaccine going for not just the healthcare professionals and the frontline workers and those who are the most vulnerable who badly need this vaccine, but also to the countless other people across the United States and across the world who need this cure for this awful, awful virus. And this leads me to the last point I want to make for all of you. And that is, treat science the way you want others to treat you. I've decided to add science not just as a special field, but I think the way we treat science, perhaps we can look at the way that we are taught and the ways we are taught to be treating others. We need to be treating others with that kind of open-mindedness, to have that sense of respect, have that sense of curiosity. I think it's all right to ask those tough questions, asking the tough questions to scientists and non-scientists, ensuring that people have active conversation. Science is what we make of it in terms of the forms that it can possibly permeate. If we don't have those kinds of conversations, we don't have those forums for scientists and non-scientists to engage, science as an institution, as a field, is going to dwindle. And that's going to be really, really devastating for us. Most importantly, I think we should have fun with science. There's so much serious talk about science that it's just not engaging. It seems like now science has become the information that you have to know either from a government site or from a class which you may or may not care for very much. I think it has to go far, far more than that. It has to be more engaging. Understand that it is a trying time, and there are very, very serious public health measures that have to be followed. But I think in the long run, as we think about the role of public health and the role of science and the role of the scientific community, especially when it deals with very, very sensitive political issues, and it's a very fine line to walk between science and politics. As we start to think long term, I think there's got to be ways. There has to be ways for especially young people to engage in science, to engage in all these things. I think this is what the founders wanted. I think they want a country where people can pursue subjects of interest without having concern that there are constraints based on people's particular views or particular interests. They want an education system that fosters creativity, that fosters innovation. That's exactly what we need. And we are delivering a lot of that. But I think we can do a lot more. There's so much more territory that can be explored. Look at the Space Force. Look at how so many boundaries are being pushed because there are people who believe in innovation, who believe in science, who believe in America, and believe that we can get to those places that we never could have dreamed before. Almost revisiting that idea when that moon landing occurred in 1969, amidst all that turmoil, amidst all that unrest that was happening at the time, there was something that people could love and people could cherish. I think that something like the moon landing will excite people of all generations about science. And on that note, I can't wait to explore more topics relating to science, relating to public health measures, relating to ways in which we can come together and look forward in the short run and in the long run about what our public health philosophy is going to be, and hopefully a way so that we can not only keep people safe, but also keep people as free as they can. Those are our goals. Those are our challenges, but we're going to face them. I hope that the 1793 yellow fever epidemic will serve as an important lesson for future generations and for the office of the presidency, because this was no doubt one of many challenges that the country had to face. And as we confront this public health crisis, and as we look forward into the future, I just want to say that I'm hopeful about the power of innovation, the power of people to come together in solidarity and to think about others. I saw an amazing story a few days ago about a drive-through in Minnesota. It was at a Dairy Queen location, and there was just one man who started this whole chain of people paying it forward for the car behind them. Paying it forward, and that lasted 2.5 days, lasted through 900 cars. Just one act of kindness, a drop of kindness, just can spur so much goodwill. I love that story. I think that's an example of the number of great stories that are yet to be told about how people are supporting each other during this pandemic. During these difficult times, I'm thinking about the Friends and Fellow Citizens community. If any of you are going through tough times, I just want to let you know that I'm praying for you, that we will come together. We will get through this together. We will prevail. And on that, thank you so much for listening to this episode. I hope you learned something valuable. Again, stay tuned for those 2 holiday specials coming up later this month in December 2020 before we wrap up the end of the year. Have a great rest of your day and a great rest of your week, and I'll see you next time. Take care and so long.